AEDs are designed to be simple to use. Voice, lights, and screen instructions guide a user in operating the device.
Remove clothes from patient's chest.
There are many different brands of AEDs, but the same basic steps for operation apply to all. Opening the lid will turn on the power for some AEDs. With others, simply press the power button. This starts voice instructions and readies the device for use.
Apply pads to patient's bare chest.
Pads must be applied to a bare chest. If needed, quickly tear away or use scissors to remove all clothing from the torso. For a woman, remove the bra to provide better access for pad placement. Locate and pull out the defibrillation pads. The pads have pictures on them to show proper placement. Proper placement will assure that the pads are able to direct the electrical shock through the heart. Peel the pads from the backing sheet one at a time and place them as shown in the pictures. Place one pad below the right collarbone, above the nipple, and beside the breastbone. Make sure it adheres well by pressing it flat. Place the other pad lower on the left side, over the ribs, and a few inches below the armpit. Again, press firmly.
Stay clear of patient. Analyzing.
An AED automatically starts analyzing once the pads are in place. Stop CPR. Movement can interrupt the analysis. Be certain that no one is touching the person.
Shock advised.
If defibrillation is advised, the AED will begin to charge for shock delivery. Quickly look to make sure no one is in contact with the person before delivering the shock.
Now, shock delivered.
Once delivered, immediately resume CPR, starting with chest compressions. AEDs are also designed to detect problems during use and guide you through corrective actions.
Replace battery immediately. Be sure.
If a troubleshooting message occurs at any time, stay calm and follow the AED's voice instructions.
The primary assessment is a simple way to quickly identify if a life-threatening condition is present. It is the initial approach to anyone suspected of being ill or injured. If it is safe to do so, begin by checking for responsiveness. Tap or squeeze the shoulder and ask loudly, "Are you all right?" If unresponsive, have a bystander activate EMS and get an AED. If you are alone, immediately alert EMS and get an AED yourself. Quickly return to the person. If you have a mobile phone, use it to activate EMS. The speaker function will allow you to follow instructions from an EMS dispatcher while providing care. Quickly look at the face and chest for normal breathing. Weak, irregular, gasping, snorting, or gurgling sounds can occur early in cardiac arrest. These actions provide no usable oxygen. This is not normal breathing. Take no longer than 10 seconds. If you are unsure, assume breathing is not normal. If the person is not breathing or only gasping, perform CPR beginning with compressions. If the person is breathing normally and uninjured, place her in a side-lying recovery position. The recovery position helps protect the airway by using gravity to drain fluids from the mouth and keeping the tongue from blocking the airway. Place the arm nearest you up alongside the head. Bring the far arm across the chest and place the back of the hand against the cheek. Grasp the far leg just above the knee and pull it up so the foot is flat on the ground. Grasping the shoulder and hip, roll the person toward you in a single motion, keeping the head, shoulders, and body from twisting. Make sure the head ends up resting on the extended arm and roll far enough for the face to be angled towards the ground. Make sure there is no pressure on the chest that might restrict breathing. Frequently assess the breathing of anyone placed in a recovery position. The condition can quickly become worse and require additional care. Always perform a primary assessment anytime you suspect someone is ill or has been injured to quickly determine the need for CPR.
I'm Belinda, the event coordinator. How's everything going today?
Everything is great.
Wonderful. Just let any one of us know if you need anything, okay?
I will, thanks.
You should have seen it. It was very funny.
And for once, we came early.
Greg! What's wrong? Greg! What's wrong?
Ma'am, I work for the venue. I can help.
Please help him.
Let's roll him over. Sir, can you hear me? Sir!
Sammy, this is Belinda. A guest collapsed in the event room. Please send the AED up.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Yes, we just had a guest that collapsed and he's not responsive. No, we don't think he's breathing. Yes. We have another employee doing CPR on him.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19,
Excuse me, I need to get in
21,
here.
22, 23, 24, 25, 26, 27, 28, 29, 30.
Folks,
Remove
please
clothes
follow me.
from patient's
Let's
chest.
give them some room to work.
Look carefully at the pictures on the
2,
white
3,
adhesive
4,
pads.
5,
Peel
6,
one white
7,
pad
8,
from
9,
the gray
10,
case.
11, 12,
Place
13,
pad
14,
exactly as shown.
17, 18, 19, 20.
When the
21,
first
22,
pad is in
23,
place,
24, 25,
peel the
26,
second
27,
pad.
28, 29, 30.
Stay clear of patient. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. Shock advised. Stay clear of patient.
Are you clear?
Press the flashing orange button now. Shock delivered. Be sure
Immediate,
emergency
high-quality
medical
CPR
services
and
have been
defibrillation with an
4,
AED
5,
from a
6,
bystander
7, 8,
can double
9,
or even
10.
triple the chance for survival from sudden cardiac arrest. Before anything else, pause and assess the scene for hazards. If the situation is dangerous to you, do not approach. If it is safe, quickly assess for responsiveness. If unresponsive, activate EMS and send someone to get an AED. Check for normal breathing. Do not be fooled by gasping actions. If not breathing or only gasping, begin compressions at 100 to 120 times per minute. Remember that quality matters. Push hard and push fast. Do not lean on the chest. After 30 compressions, give 2 rescue breaths. Establish an airway first and give only enough air to see the chest rise, but no more. Do this quickly in less than 10 seconds. Return to compressions and perform ongoing CPR cycles of 30 compressions and 2 rescue breaths. Compress hard and fast. Allow the chest to fully recoil to its normal position after each compression. Use the AED immediately when it arrives. Turn on the AED and adhere the defibrillation pads to the bare chest.
Stay clear of patient. Analyzing.
Allow the AED to
Stay
analyze the
clear
heart.
of patient. Shock advised.
If a
Stay
shock is
clear of
advised,
patient.
make sure you are not
Shock
touching the
now.
person before delivering the shock.
Shock delivered.
Immediately after the shock is delivered, resume CPR cycles of 30 compressions and 2 rescue breaths. Voice instructions and additional analysis by the AED will guide you through further care. Don't stop until the person shows signs of life another provider or EMS personnel take over, or you are too exhausted to continue. If a person clearly responds, stop CPR and place the person in the recovery position. Leave the AED on and attached in case cardiac arrest returns. If a shock is not indicated by the AED, immediately resume CPR. Continue to follow the AED's instructions. Blood pressure is created and maintained with ongoing compressions. When compressions stop, pressure is quickly lost and has to be built up again. Avoid interruptions to maintain high-quality CPR. Performing effective chest compressions is tiring. When others can help, take turns performing CPR. Quickly switch compressions every few minutes. When possible, do this during the automatic AED analysis that occurs every 2 minutes. Do the best you can. A person without breathing or circulation will not survive without help. Nothing you can do can make the outcome worse. Compression-only CPR is an approach that is being widely promoted to people who are not trained in CPR. Simple instructions in compression-only CPR can be shared in many different ways, including social media and as public service announcements. EMS dispatchers can also provide compression-only instructions during an emergency call. However, compression-only CPR is a limited approach. At some point, rescue breaths are essential for all cardiac arrests, especially those involving an airway or breathing problem, or those involving children. As a trained provider, perform both compressions and breaths during CPR. If you are unable or unwilling to perform rescue breaths, you should provide high-quality, uninterrupted compressions at a minimum.